A special thank you to each of our subscribers who make this channel possible. Here's today's story. In a heated Senate Finance Committee hearing, Health and Human Services Secretary Robert F. Kennedy Jr. made controversial claims regarding mRNA vaccines, stating they could cause death, particularly among young people. This assertion came in response to questioning from Senator Michael Bennet, Democrat Colorado, who highlighted remarks from Dr. Recep Levy, a newly appointed member of the CDC Vaccine Advisory Committee, who had suggested that evidence against mRNA vaccines was mounting and indisputable. Kennedy's agreement with Levy's statement raised eyebrows, especially given Levy's lack of a medical background and the ongoing petition for his removal from the committee. The mRNA vaccines from companies like Pfizer and Moderna have been at the forefront of the COVID-19 vaccination campaign. During the hearing, Kennedy's demeanor was described as raspy and strained, with viewers noting his labored breathing. He engaged in a series of testy exchanges with both Democratic and Republican senators, including Senator Bill Cassidy, Republican Louisiana, who pointed out that Kennedy had previously suggested that the COVID vaccine had killed more people than the virus itself. Kennedy adamantly denied making such a claim, despite Cassidy's insistence that the current vaccine rollout has been limited by the FDA to certain demographics, effectively denying access to many. Senator Jeff Merkley, Democrat Oregon, pressed Kennedy on the staggering number of COVID deaths in the U.S., which surpassed 1 million in May 2022. Kennedy's response, indicating uncertainty about the death toll, left Merkley visibly stunned. The senator questioned Kennedy's stance on whether the vaccines had played any role in preventing additional deaths, highlighting the lack of clarity in Kennedy's statements. As the hearing progressed, tensions escalated. Senator Todd Young, Republican Indiana, raised concerns about long COVID, a condition affecting millions of Americans, and pressed Kennedy for actionable solutions. Kennedy responded by emphasizing a collaborative approach with a consortium of doctors, rather than relying solely on traditional research methods. This stance seemed to resonate with Young, who acknowledged the need for more effective treatments. The former CDC director, Susan Menares, came under scrutiny as Kennedy faced questions about a meeting held with her and the current acting director, Jim O'Neill. Kennedy admitted to requesting Menares' resignation but denied any allegations that he demanded she fire career scientists. This led to Senator Raphael Warnock, Democrat Georgia, accusing Kennedy of having a dangerous agenda that threatens public health, to which Kennedy retorted, questioning how he could be seen as a threat. Senator Thom Tillis, Republican North Carolina, sought clarity on Kennedy's position regarding Operation Warp Speed and his plans for empowering scientists within HHS. He expressed concern over Kennedy's controversial actions, including the firing of CDC officials and the restructuring of the Vaccine Advisory Panel. In a particularly heated exchange, Senator Bernie Sanders, Independent Vermont, challenged Kennedy on the efficacy of the COVID-19 vaccine, referencing former President Trump's praise for the vaccine as a groundbreaking medical achievement. Kennedy's responses seemed to waver, as he acknowledged the leadership shown by Trump, but stopped short of fully endorsing the vaccine's life-saving capabilities. The hearing culminated in a chaotic back-and-forth between Kennedy and Senator Elizabeth Warren, Democrat Massachusetts, who pressed him on vaccine recommendations and access. Kennedy's insistence that he would not recommend a vaccine without sufficient clinical data was met with skepticism from Warren, who argued that his recommendations were effectively denying many Americans access to vaccines. Kennedy countered by asserting that most people would still be able to obtain vaccines at their pharmacies for free. As the session drew to a close, Senator Catherine Cortez Masto, Democrat Nevada, questioned Kennedy's knowledge of Medicare drug pricing and his commitment to tackling pharmaceutical companies. Kennedy struggled to provide coherent answers on the specifics of drug pricing, and the implications of recent legislation raised further doubts about his leadership effectiveness. This Senate hearing has sparked significant debate, with Kennedy's statements igniting controversy and raising questions about the future direction of public health policy under his leadership. As the nation continues to grapple with the COVID-19 pandemic and its aftermath, the implications of Kennedy's remarks and decisions will likely resonate for some time to come. That's all for this story. We upload videos every day covering many different subjects, so hit that subscribe button to stay informed. Thanks for watching.